In this video by Deckplate, we will understand the VA disability ratings for mental disorders. Major or mild neurocognitive disorder, due to another medical condition or substance, medication-induced major or mild. Neurocognitive disorder, generalized anxiety disorder, specific phobia, social anxiety disorder, social phobia, obsessive compulsive disorder, other specified anxiety disorder, panic disorder, or agoraphobia. Unspecified anxiety disorder, dissociative amnesia, dissociative identity disorder, depersonalization or derealization disorder, somatic symptom disorder. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA assigns diagnostic codes to mental health conditions and evaluates their severity based on the impact on a veteran's social and occupational functioning. Each mental disorder falls under the general rating formula for mental disorders, which provides criteria for ratings ranging from 0% to 100%. Major or mild neurocognitive disorder due to another medical condition, or substance, or medication-induced neurocognitive disorder. Diagnostic code 9326. This condition involves cognitive impairment caused by another medical condition, or due to the use of substances or medications, affecting memory, attention, and reasoning abilities. Generalized anxiety disorder. Diagnostic code 9400. Generalized anxiety disorder is characterized by excessive, uncontrollable worry and anxiety about various aspects of life, causing significant distress and impairment in daily functioning. Specific phobia, social anxiety disorder. Social phobia. Diagnostic code 9403. Specific phobias involve intense fear of specific objects or situations, while social anxiety disorder, social phobia, is the fear of being embarrassed or judged in social situations. Obsessive compulsive disorder, OCD. Diagnostic code 9404. OCD is marked by intrusive, unwanted thoughts, obsessions, and repetitive behaviors, compulsions, aimed at reducing anxiety caused by these thoughts. Other specified anxiety disorder. Diagnostic code 9410. This includes anxiety disorders that don't fully meet the criteria for specific anxiety diagnoses but still cause significant distress or impairment in functioning. Panic disorder and agoraphobia, diagnostic code 9412. Panic disorder involves sudden and repeated panic attacks, while agoraphobia is the fear of being in situations where escape may be difficult, often leading to avoidance of public spaces. Unspecified anxiety disorder, diagnostic code 9413. This includes general anxiety symptoms that do not clearly fit into a specific anxiety disorder category but still affect daily life. Dissociative amnesia, dissociative identity disorder, diagnostic code 9416. Dissociative amnesia involves the inability to recall important personal information, while dissociative identity disorder involves multiple distinct identities or personalities that take control of the individual. Depersonalization or derealization disorder, diagnostic code 9417. This condition is characterized by persistent or recurrent feelings of detachment from oneself, depersonalization, or surroundings, derealization, as though observing from outside the body or in a dreamlike state. Somatic symptom disorder, diagnostic code 9421. Somatic symptom disorder involves excessive focus on physical symptoms, such as pain or fatigue, leading to significant distress and impairment, even if no medical condition fully explains the symptoms. The VA uses the same general rating formula for all these mental disorders, assessing them based on their severity and impact on occupational and social functioning. 100% rating. Total occupational and social impairment, due to such symptoms as gross impairment in thought processes or communication, persistent delusions or hallucinations, grossly inappropriate behavior. Persistent danger of hurting self or others, intermittent inability to perform activities of daily living, including maintenance of minimal personal hygiene. Disorientation to time or place, memory loss for names of close relatives, own occupation, or own name. 70% rating. Occupational and social impairment, with deficiencies in most areas, such as work, school, family relations, judgment, thinking, or mood. Due to such symptoms as suicidal ideation, obsessional rituals which interfere with routine activities, speech intermittently illogical, obscure, or irrelevant, near continuous panic or depression affecting the ability to function independently, appropriately and effectively, impaired impulse control, such as unprovoked irritability with periods of violence. Spatial disorientation, neglect of personal appearance and hygiene, difficulty in adapting to stressful circumstances, including work or a work-like setting, inability to establish and maintain effective relationships. 50% rating. Occupational and social impairment with reduced reliability and productivity due to such symptoms as flattened affect, circumstantial, circumlocutory, or stereotype speech, panic attacks more than once a week, difficulty in understanding complex commands, impairment of short and long-term memory, impaired judgment, impaired abstract thinking, disturbances of motivation and mood, difficulty in establishing and maintaining effective work and social relationships. 30% rating. Occupational and social impairment, with occasional decrease in work efficiency and intermittent periods of inability to perform occupational tasks, although generally functioning satisfactorily with routine behavior. Self-care and conversation normal, due to such symptoms as depressed mood, anxiety, suspiciousness, panic attacks, weekly or less often, chronic sleep impairment, mild memory loss such as forgetting names, directions. Recent events. 10% rating. Occupational and social impairment, due to mild or transient symptoms, which decrease work efficiency and ability to perform occupational tasks only during periods of significant stress, or symptoms controlled by continuous medication. 0% rating. A mental condition is formally diagnosed, but symptoms are not severe enough either to interfere with occupational and social functioning or to require continuous medication. Thank you for watching this video. Please don't forget to subscribe and like our videos.